Good afternoon. Thank you for joining. Good afternoon, ma. So we're just waiting for the number of guests. I know one is here live. I hope you can send a request. So family, I have sent another request, sir. Okay. Thank you, fam. So one of our guest speakers are here. Hello, family. How are you?
Hello, can you hear me?
Yes.
I'm fine. Good day.
Good.
Oh boy. Okay, let me run a network connectivity test and see if it works.
Okay.
Because I'm entering a place of low connection. I want to use Sanusi because they are not that busy.
Okay, sir. I'm very grateful, sir.
Well, I found network. I found network, but I can't. Do you have the phone number yet? Okay. Can you see him, ma'am?
Yes, I can. I could hear you all the way.
I cannot see this many screen. That's the thing.
All remaining. Okay, so
I'm coming. Let me leave and set up. Let me see what I can do it. Oh, fantastic! All right. Can you still hear me?
I can hear you, but we can't see you.
Yeah, I just turned off my video now. So let me see if I can connect with my laptop to see a better quality of screen. All right.
Hello, Lee. Good afternoon.
So that's what having everybody knows Yanurua. There's another pharmacy, but one of the pharmacists won't be joining today. He's been dead for a while. I know we'll pray for him after we're done with our session today because his birthday is even tomorrow. But Farm Splendor is also going to set up. So here, these are pharmacists. They're men of honor. They have done due diligence going to school, and they're also in practice at managerial roles, excellent roles. So yes, I'm very honored to have all of them here. Um, like the topic has been shared, and it's a fun one. And yes, we got a lot of questions in flow. I'll be reading some, and yes, my colleagues will be answering. Um, Mr. Sumter, thank you for joining. So yeah, like I said, it's us just debunking a number of myths that we have, some ideas that we don't, because we realized, myself and Mil, a number of us in the community settings especially, that people come in and they just ask very funny questions. And like, for these questions to be, there must be something moving in our community that is instigating and also fueling it. So we've decided to take a number of them, feedbacks that we got, and answer them professionally, also on a play note. But yes, answer them quite professionally so we know what is what. And there is just so much power in having to know. But you may not know as intrinsic as we that in the professional board, but there's just good and safety that abounds when we are very knowledgeable, right? Yeah, so that's where this um, today's webinar and today's shared thoughts is from. Um, okay, so I'm waiting for Famil. I'll just wait like in some minutes. Famil, can you still hear us?
Yeah, I can still hear
Yes.
us.
Okay, so I'll be asking the questions actually. I won't be doing any answering. I don't know if I'm.
Wow, really? Wow.
That's the beauty to it now. That's the beauty to it. It's a platform, so I won't be jogging down too much of my knowledge. I'll be asking. It's good. It's good that not every time the dish and taking some nuggets yourself. Yeah, we have amazing people to share this course. So I'll be introducing now, sir. Famil. Are we ready?
Okay, that's fantastic.
Okay. So
Let's
so Famil is my colleague. Yeah, so he's my colleague. He works at MedPlus Pharmacy. He is the best pharmacist as at last year when I was still at Med Plus. He won the best pharmacist. He is amazing. He is approachable. He's manager of his store. He's even in another store right now. He's that friendly. He's he's been able to weave in practice with community and with um, access to knowledge, access to good medications, and also access to amazing service. Because we realize that everybody is just one way angry or just irritated, but immediately you come across family, there's just a peace. There um, is welcoming. So I'm very honored that he's even sharing this time because I know he's very busy. So we're really, really sharing this time with us. Famil, the floor is yours.
Yeah, that is only if my head no voice.
Okay. So not to
Thank you, family.
thank you so much. So we're very grateful. So not to waste so much of our time, I will be starting with the first question. We have a lot of questions. I know Famil be because I've shared some of the questions with him and he was like, what? So yeah, we have a lot of questions. I was shocked that people would give this many feedbacks, but I'm grateful. So I'll be doing the first question, which is very vital. It's a very, very vital one because we have that conversation every time if I'm male, and I know you've heard this question all the time. It's medication. Can medication be taken safely with any liquid?
Okay, good afternoon, everybody, and those that will watch after now. Thank you, Brown Essence Healthcare, for having me on this show. Thank you, Pharmacist Yano, your sister and a colleague. Okay, let's delve into the news for today. So let's see. So can we take medications with any liquid? The easy answer is no.
Okay.
The harder, of course, yes. Because when you look at the question, it says can 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 denote ability. So as an adult, you have the gift of choice. But as a healthcare professional, let me tweak or rephrase that question a bit. Should you take medications with any liquid? Then the answer would be no. Medications should only be taken with the recommended liquids. Medications should only be taken with the recommended liquid, and this recommendation should come from your healthcare provider or the healthcare professional. As a rule of thumb, liquids will be most safely taken with plain water, lukewarm water. So if in a case that someone is confused of what liquid to use to take a particular medication, there's a general rule of thumb. Medication should be taken with room temperature, pure, bottled, or sachet water, as the case may be. However, in some instances, medications would have to be taken with other liquids that are not lukewarm water. But this will be given by your healthcare provider. I can give you an example. Some medications may be taken with yogurt.
Mm.
Some medications should be taken with cool or cold water.
Mm.
Exactly. Yeah. Some medications may be allowed to be taken with fruit juices, actually. However, like I said, before you take any medication with any kind of liquid, you you must have a confirmation from your healthcare professional. So one thing you can take home is that the rule of thumb and as a safeguard is that take your medications with room temperature water, either bottled or sachet, as the case may be. Thank you.
Very grateful, fam Mill. Yes, we call you fam. Your name is actually fam Michelle, but we call you fam. Am I correct?
Yes, my name is actually Michelle. Yeah, but I'm more popularly known as Mill.
So, thank you so much, fam, because that was very insightful. I even had to jot that. Because I've realized that people tend to shy away from medications because they want to take it with the easiest form of drink, let's say like soda and all of that. And some they permit some drugs or some tablets or medications I maybe permit that you can, but some you actually have to specific with water, like you said. And most questions I think we even have, I think I'm just being very another question we had, but I didn't just put it out there was can we take medication with alcohol? A lot of people were asking that. So that's like the B part of it. Just want to answer all that.
Alcohol is the medication itself. Most people don't know. Most people don't know, but alcohol itself is a medication. And alcohol has been shown to have diverse interactions with most classes of medications. So on no account should you take your medication with alcohol. This because of the possible interaction that may occur between the medication you're taking and the alcohol used in taking it. For example, there's what they call synergism. First of all, is that alcohol may increase the potenticity of medication, which will in turn increase its harmful effects. So, like we all know, most medications have side effects, right? So now when you use alcohol to take a medication, it may potentiate the side effects of this medication, leading to very disastrous or negative consequences. So, for example, the common drug metronidazole or flagyl, which is commonly used for cases of, stomach or abdominal illnesses, is to manage some abdominal illnesses like diarrhea, dysentery. Did you know that if you take flagyl with alcohol, you are setting up yourself for very big disaster? There's a reaction called disulfiram reaction, whereby the azole group reacts with the alcohol and it triggers things like vomiting, feeling of malaise. You just feel terrible in general. So that is why we should not take medications with alcohol. Also, some medications are inactivated by alcohol. So the moment they come in contact with alcohol, you render them useless. You render them impotent. Therefore, you're just swallowing medication and you're not having the beneficial effect that you should get. Some other time, even though the alcohol do not destroy the medication, but it limits its effectiveness. So although you're taking the right dose, but you are not getting the full benefit of that medication. So for these reasons and a lot more, medication should never be taken with alcohol. In fact, you should not even consume alcohol while taking medications. You have to wait until you're done with the medication, the duration of the treatment, before you maybe commence taking alcohol. Thank you very much.
Thank you so much. I'm very grateful. I really wanted us to have like an insight to that. It's always a lot of questions. Yes, and I know from Mil you have experienced this question 1,000 times. it makes
A lot.
it,
In fact,
it makes you cry.
we beg.
So, and
They beg. And I'm like, I'm not alcohol. Even if I say go ahead, it will still react. You know, it will still react. So,
Okay.
so I have patients who have begged me, please allow me to take alcohol and this medication, and I'm like, it's not in my power to stop the reaction that will happen.
Okay. Okay, so we'll be moving to the next question. I knew that question was going to be very elaborate. I'm sorry, I know from time to time we noticed that someone was trying to join and off and out. That's from Splendor. I think he'll try to join again. Is I think he said he's in the hospital right now. But that's fine. I wanted to introduce you, but it's already off again. So we're going to the next question. Hmm, this question one has caused a lot of multidisciplinary rift. And to be honest, customers and clients actually ask this question because they want to know what's the balance in their health. Because we've come to realize that the clients, the patients are the reason why every health sector is in. They're the major stakeholders. The reason why I am here, family is here, is to satisfy someone, is to help someone's health, is to help the community. It goes on and on and on. But like the patient is like the main cause. So there's this question everybody asks, people that are close enough, clients that are close enough, even family members that. And this question goes to us. My doctor knows everything. Is it true? I saw the green. This question, it has cost a lot.
This is a big setup.
I know.
A setup. Alright.
Stop.
Okay. Let me hear the question again.
Hmm. My doctor knows everything. Is it true?
Hmm. Ah, this one has personalized the matter. I don't know who your doctor is. So if he be say he knows everything, if he just be, but let me rephrase the question.
Please
Eh?
do.
Let me rephrase the question and say, do doctors know everything? I believe when we now look at the question this way, it gives us a better leeway, to answer. So, do doctors know everything? If your doctor is still a human being, if he's still mortal, if he's still putting on flesh, because of, if not for anything else, because of that particular factor, because he's still human, he's still mortal, the answer is that no. Uh, Despite the title, a physician or any other healthcare provider, pharmacist, a dentist, a nurse, any other professional in any field, nobody has the absolute control of knowledge. Not because we are not brilliant enough, not because we are not intelligent enough. It's just because we are still mortal, we are still putting on flesh, we are still human beings susceptible to mistakes, to forgetfulness, and we do not have eternal memory storage. So someone may be very learned, may be very experienced, but still does not know everything. So that's one of the limitations of being a human being. It's not necessarily a character flaw or a personal flaw. So no healthcare professional, no healthcare provider, no professional in any field of endeavor knows everything. I believe that should do justice to that
I
question.
believe so too. I really do. Because, yeah, I believe so. Okay, so we're moving on to the next question. We will not drag any inter or multidisciplinary professional question, to be honest. I think that was just spotted right too much because it can go back and forth. That debate. I'm very grateful on how you
Yeah.
study and the insights, sir. We're very. But question, this question is, I don't know, maybe it's a youthful. I don't even think it's a youthful thing, or it's not a man, women. There's just this thing about this concept, right? And I just want to put
Mm.
or bring an insight into it. It's not that we're even answering into the dot. It's just like a question that just needs a bit of insight, a bit of explain how this works and what we can do. And the question goes to us: muscle turns into fat when you stop exercising. Is this true? Because this is it. To be honest, let me even say it. It's a woman that sent me this thing. And I think I understand that where it's coming from. I don't know what her patterns are. Stops working out, but it was sent with it. So we're asking, muscles turn into fat when you stop exercising. Is it true?
It is. I want to use a. I want to use a very heavy word so that we could destroy this myth. Like we would blow it into smithereens. We'll blow it into specks of dust. It is absolutely impossible, eternally impossible for muscle cells to change into fat cells and vice versa. Fat cells cannot turn to muscle cells. Muscle cells cannot turn to fat cells. The most pivotal reason is because of their inherent makeup. It's just like saying, can an elephant turn into a chimpanzee? It's not possible because the makeup of an elephant and a chimp is different. So the same thing with fat and muscle cells. Muscle cells have components in them that make them muscle cells. And there's nothing you would do in this world to change them from being muscle cells, except you're able to take out those components. And guess what? The moment you take out those components from them, they cease being muscle cells. The moment we take out what makes an elephant, the moment we modulate or tweak its genetic conformation, it ceases to be an elephant, right? So exactly the same thing with fat and muscle cells. Muscle cells contain what they call myosin and actin filaments. These are not present in fat cells. Secondly, muscle cells are arranged in bundles. They are arranged in bundles, are made up of fibers. Fat cells are not configured that way. So there is no reaction, no chemical process, no alteration that will convert a muscle cell to a fat cell. Neither is there any workout, program, drug, action, or reaction that will make a fat cell be converted into a muscle cell. So even if you stop exercising, in fact, there are people who from their birth to adulthood, they never exercised and they did not turn to fat. So because of that, that shows you that fat cells and muscle cells are not interchangeable because they are different structurally. Their composition are different. They are opposite ends. They are not similar at all. So they can't be, converted to each other. So even if you stop weight lifting, if you stop training, don't be scared, your muscles will remain muscles and they will not be converted to fat. However, what will happen is that muscle thickness, muscle size Even muscle number may reduce. There's something called atrophy. Atrophy is reduction in size due to lack of use. So when, for instance, someone has a POP, or a sling on their arm, maybe they dislocated their elbows, and they don't use that muscle for like a couple of months, years, we find out that let's say they had the dislocation on the left arm, we find out that the the muscle, the come on, give me a minute, please. The biceps, the biceps of the left arm that has not been exercised or used for a long time will usually be smaller in size than its counterparts. So that's what really happens when you stop exercising, lifting weights, training. Muscle thickness, muscle elasticity, muscle endurance reduces, but it does not get converted to fats. Thank you very much.
I'm very grateful, sir. I'm very grateful. Beautifully, I would send that clip of that answer to that person because she didn't join, so I knew it was a concern for her. Thank God we can hide people, but yes, just explain it to her because she's been losing a lot of morale. So every time I try to explain it, I don't think she really gets it. So I'll just send that. So this question, I would actually be answering it. So Famil, let's pause a bit. I'll be answering this question. Um, and it goes, all medical information online is accurate. Okay, so I know that in this time and with how everything has advanced, thank God for technology, there is breeze of information on um, everyone's fingers rather. But it needs to be corrected that not all information online are accurate. Thank God for people like Apoc Doctor. Thank God for a number of people like us too, that tend to also debunk this. People go read some things and they come back. One, be sure of what you're even reading from, where you're reading from. Because I can post online. You that you're asking if it's accurate, you can post online. So if it's that easy to be able to post information online, that already just settles that everything online is not accurate. And we also have to be very careful, and this would be made to a point of helping people and also explaining to people that we have to be very careful of what we ingest online because a lot of things are going. And online is not just Wikipedia, it's not just Safari, Google, even on WhatsApp, a lot of health information, a lot of medical information are passed. I would give a scenario of the Ebola time. I think I was in school that period and I heard that someone that was admitted to my school then, which was Lut, was admitted as a result of the information they got that they should use salt water and hot water, and it burns that person's skin. I don't even know what kind of interaction the person used with the salt. Literally burns the person's skin, almost a second degree burn. So let's be very careful. Because you ingesting it may not now work for you, it will even become harm to you. So please, not just debunking that, we're also putting out um an advice and also a plead cry that please ensure you reconfirm. You can reconfirm with a professional. You can reconfirm with eligible site like Healthline. They're quite good. Mayo Clinic. But even at that, always just ask questions. Ask people that are in the professional setting questions and ensure that you're accessible to these people too. Because I realize that's also part of the reasons why this is also a problem. There's no access. So just build um, or create access to that. Be nice to people, yeah? Let's go start from there. You're nice to people, they would always want to give you feedbacks and also reply to your questions. Okay, so that is out of the way, and I'm very grateful I was able to answer that. Oh, fam, do you have any other thing to add on that, so I don't just round it up?
Your answer was very spot on, actually. Yeah, with the preponderance of knowledge and information spread, there's increased tendency and susceptibility for false or wrong information to be mixed up with right information. So that's why you should always have discussions with your healthcare provider. They are in the best position to, counsel you through whatever reading or finding you have done using the internet. Also, knowledge, the rate at which knowledge is being acquired currently is very much exponential. So what you know or knew to be true a couple years ago may have been proven false. A classical example is the red wine and little quantity of alcohol being good for the heart. That's a very good example. So in recent times, that theory has been debunked. Yeah, I will stop there. So that table has been broken. The 4 legs have been evacuated.
Very, very scattered. I'll put on the lighter note. I had a client that needed Lamisil, antifungal cream and tablets, and it was simple. But I heard because it says it goes out and no fungal now. You have to treat it for a long time, at least 2 weeks, shortest dose. And like, oh, I have to go out. I'm a man, but she was like, but I heard that wine is very good for the heart. Which I want to start explaining. You know when they give you that, like, where do you want to start explaining from? Just told him based on research, theories now, and what has been proven is not as safe as it used to be. And I think he got the message because one, he didn't even use the tablet at all. So I knew it's either he took the wine and decided God, thank God for health system, because you can actually lose your mind when you get feedback. You're like, you actually took pleasure over your health. Okay, that's not on me, but we'll move on. Okay, so we're moving to the next question. And God, time is running. I don't even know. Because I want by 12:45, I want us to like round up and just, I know questions are more, but it's okay. We can always do a 2.0. Or maybe it will be on Farm News page by then. So this is us pushing you out there. I know there's no time, but we need you out there. We need you giving us this nugget. So maybe a 2.0 will be on Farm News page. So this question, this question is for Wiwi, but we'll still share because it's still Wiwi. The Wiwi that asks the questions. Actually, a professional that asks the question. I will not talk too much. But it goes, you can't get an STD if you use condom. Is this true? Supposed to add a double. Oh my God.
I hope Rekit Beknista and DKT would not come for us.
Hello, fam. Can you hear?
Sorry, I had a network glitch. I'm back. So let me hear the question again. Very interesting.
The person it's a question, right? But it's saying you can't get STD if you use a condom. true or false. It's fine, you can explain, but the person just wants to, because apparently there is something leading to that, so they want to know.
They want to know. Okay. All right. The answer is false.
Very false.
It's very, very, very false. No hard feelings to Durex
That's why I said
or what's the other name
I
again?
need WHO personnel here that will save us.
Exactly. uh,
Before they start
you
suing
see,
us. But yeah.
there now condoms afford us a certain degree of protection against sexually transmitted pathogens or disease-causing agents, viruses, bacteria. They afford the user a certain degree of protection. But even on those condom labels, they will tell you that the degree can go as high as 90, 95, but never 100%. The reason is because there are some bacteria and viruses that are way smaller than the pore sizes of the condoms. So if you understand the way condoms are made, they are latex, most often are latex, and they are blown. Now, to the when I mean they are blown, they are blown to get that balloon like feel, right? So there's hot air that is blown there and it's molded, they are kept in molds or something like that. Now this is it. To the human eye, that is almost waterproof. I use the word almost waterproof. Your eyes cannot see any space or hole. To the human eye, it looks completely sealed, nothing coming in, nothing going out. However, under an electron microscope, you would see that there are micro pores in those condoms, basically. And if, for example, the size of that micropore is like let's say 2 nanometer, a microorganism that measures 0.5 nanometer can easily, very, very easily pass through that pore size. That is why condoms do not guarantee absolute protection over STDs. So better be safe than sorry. That's what I would say, even when using condoms.
Even WHO, since everybody's looking for research and referrals, we always say A is always the best option, and that's abstinence. So if it's
Yeah.
possible, abstain. But yes, we have the married people, right? So just be loyal. I guess it goes. It can be very deep. That condom.
Married people, go ahead. Those who are married, go ahead. With or without, you have permission.
But the question can be very deep. So yeah, we just that's our advice. So yeah. Okay, so I think this is the last question. So definitely we're having a 2.0, and myself and family will discuss on this because questions choke at
Yeah,
people are
I
sent,
agree.
you'll be shocked that even the ones I sent you, some people still send in more. So you see that
Wow.
people are concerned and tired of having to, because even men of honor, because even when they're asking, some people will tell me that, so not even my profession, right? I'm not talking about the health sector in general. You say a nurse told them to go and mix this thing. Ha! Always so worried.
Hmm.
So it's a lot of. Let's let me just ask this last question. At least this is also part of very common questions. I think we had like 4 of it. asked anonymously. And the question was, can antibiotics treat any form of infection?
Mm.
They were not
That
specific.
one is a no-brainer.
They were not specific. So that's why I'm not going to reconstruct that question. They were not specific.
Yeah.
Yeah. So it's going to be like that.
Okay.
Okay. So
When we use the word antibiotics, from the literal meaning of the word antibiotic means against life, right? So that's the meaning of that word, against life. However, when we use the word antibiotic in, how will I put it now, in the medical industry, in the medical field rather, we mean more of antibacterial medication. Yeah, so no, antibiotics, comma, or inverted commas rather, antibacterial medications do not treat every form of infection. That is why we have antibacterial, antiviral, antifungal, antiprotozoan, antihelminthic. We have lots of antis out there. I don't know about the uncles, but we have lots of antis out there.
antis
And
be
your
saving
HCP,
lives. We'll be saving lives.
telling you antis to be saving life since 1900s. Antis be doing a lot's work. So because of this wide and vast array of antis out there, the only person qualified to guide your choice of an antibiotic would be your healthcare provider. So please, antibiotics do not treat every form of infection. They can't. They don't even possess that potency or ability to, because of their different makeup. And even amongst antibiotics, there are some that are for a particular or a specific disease. There are some that can only, that have what they call, that is more specific towards certain diseases. That means although A, B, and C and D can do this, B is the most specific for this, and with B you will get the most efficacy and efficiency. But only your healthcare provider, the pharmacist, your physician can equip you with that knowledge. So always, like I say, always consult your healthcare professional.
Yeah. Okay, so I'm going to round up with number 11. I know I said 12:45. I'm extending it so we can also stretch or lend an hand of prayer to one of the hosts that didn't join. And the question is on the and I feel will bring a bit of empathy to us, the practitioners, and the professionals, because I feel this thing flies around a lot, even from family members, and it goes, doctors or pharmacists are always or always have perfect health. I have to debunk this. I honestly have to debunk this. It has to be broken down into, I don't know, into concrete. We have to break it down, because
Into smithereens, into iotas, atoms, electrons, protons. Divide, scatter
it
everything.
can be so annoying when maybe there's a cough and you're also coughing in this whole pharmacy. You
Well,
guys should be fine. I think, please. Yes, we tend to fall sick sometimes. We don't have perfect health. We're grateful to God and Jehovah Rapha that keeps us in good health, but no, we tend to break down. And it can be very severe too. So I hope this brings a bit of empathy to us. I don't know if it would. It sounds like I'm
you
begging for
should though.
because
You
it
should
can
though.
be sometimes it actually shoots me off my feet and puts a bit of irritation, because it's like you can pass on your information in a place of empathy instead of striking. Some be like, pharmacist, you're not feeling well. We fall ill too. Not that we are trying to carry the place of where, yes, we're extending healing. I understand where you guys are coming from, like you're in abundance of knowledge of so many healing stuff. So why should you put yourself in that space? But the body gets tired too. The body carries so many other things. So yeah, just always pray for us and always bless
Yes.
us in every way you can. Because we
Pray for
our
your healthcare professional.
always prefer because we're exposed to a lot. I remember when
Mm,
yeah, we're exposed to a lot. I remember when I was working MedPlus, and for every time, in like every 2 hours, I always go to wash my hands. And they always asking, fam, why? I said, if you know the number of things we're exposed to every time, you would know that it's God that really protects us. There's so much we can do. We're
mm-hmm.
exposed to a lot of things. And that habit, actually, they could inculcate it because they realized that one, it reduced the number of things for them. And even holding pen, exposure
Mm,
to pen alone. So, yeah, we are praying for perfect health. We are declaring perfect health over ourselves. But yes, we're asking for empathy too. We're debunking, we're breaking it down. Breaking it down so well. Okay, so this was an amazing one, and I'm so sorry we stretched the time because the time we were hoping to. Can I chip in one more? Do we mind extending to 1 p.m.? Because this one to my age group, to our age group, is they. I feel they feel like they have, I don't know, RoboCop kind of. Can I bring up this question, family? I really need you to answer this question.
okay, that's fine. Let's have it.
This
Uh,
question.
let's have it.
Hmm, it's even going to shock you, but I will still talk about it. They claim,
Let me better
they're saying,
wear wait. Let me wear insulator. This one's they involve shock. Let me put on my glove and other rubber things. Yeah, let us hear you.
okay, sir. So they are claiming and they are saying that only old people get heart diseases. Is this not true? They never ask true or false. They are saying, is this not true?
Mhm. You must follow who know road. Is this not true? Answer. There's no room for yes or no. Is it not true? Well, previously, maybe 50 years, a century ago, um, that would have had some iota of verity. That question would have had some iota of verity in it. But at the turn of the 21st century, we begin to find out that the reality that we see in the medical field and healthcare sector does not support that argument. I have seen a 21-year-old who is on antihypertensive medications. He has what they call essential hypertension, primary hypertension. He's 21 years old. He does not live a bad life. He does not eat bad or drink. No, 21 years old. He's on mainstream antihypertensive medications. I have seen people who are in their 30s, their 40s, being placed on antihypertensive medication and other cardiovascular medications. The truth is that not only old people have heart diseases. No, I don't know whether it's a genetic play or it's an environmental factor or it's a lifestyle issue or it's like I said, a genetic or hereditary thing. But now we are seeing that there has been an upsurge, an increase, a rise in the incidences of cardiovascular diseases occurring in adults, younger adults. So no, young people as well as old or elderly people have or are susceptible to cardiovascular diseases. However, age is a risk factor for developing cardiovascular diseases. So we will normally find it more in aged and elderly persons. Nonetheless, young people too have started to come down with cardiovascular diseases. This means that you have to be active and knowledgeable out there. Do not think for once that because you are yet to reach 50, you're in your 20s, in your 30s, that you can live anyhow you want. Do not think that because you are full of energy and strength now, you should not pay attention to your body and organs. No, because whether you like it or not, whether you want to believe it or not, young persons like you, like us actually, are now coming down with cardiovascular diseases, cardiac hypertrophy, angina, hypertension, and or whatnot.
Very true. Very true. I also even had a physiotherapist. She's my friend, childhood friend from secondary school that had angina. And we're age mates. I had to treat it.
Wow. Sorry about that.
It's not
So
picking a profession, not picking, it's really going crazy. And I don't know. I was going to ask that, do you even think it's because of evolution? Do you think it's because we are evolving? Or is it an exposure thing? Or I don't know.
Let's see. There's an upsurge in CVS cardiovascular diseases, right? And we know that the CVS has an interplay of more than one factor: genetics, environment, and life. The fact is that as we, become more industrialized, as we shift more away from nature, and as we develop patterns that enhance and support this shift, there will be a consequence, there will be an inverse action on everything from the planet down to the inhabitants of the planet. So even though one cannot categorically say that this is the reason why this is happening, right? We can have pointers. So for instance, now the amount of air pollutants has exponentially increased from the 90s to the 2000s. There's been an exponential increase in the amount of air contaminants consistently released into the atmosphere. Now we know that smoking, not the act, the fumes from smoking actually are a risk factor for coming down with cardiovascular diseases. However, not only cigarettes produce this smoke, exhaust pipes, diesel engines, and all that produce these fumes as well, right? And so I would say that the amount of this fume, I'm just using it as an example now, that is inhaled consistently every day, even though in small amounts, will often end up accumulating to something, to